let's go back to the politics on Parliament Hill. Is your health really suddenly in jeopardy? Remember, the Minister of Procurement, Anita Anand, had a press conference today, and she said, yeah, she alleged that a Conservative motion, which passed just hours ago today with the support of the NDP and the Bloc, that would start an investigation into the government's handling of the pandemic, will expose sensitive information of companies doing business with Canada, putting critical issues like buying a vaccine in peril, putting your health in peril. So that's her allegation. In fact, the CEO of Pfizer, which is developing a vaccine, agrees. But is it true? Look, this is definitely a mixed message from the government. After all, I spoke to Canada's Health Minister, Patty Hajdu, on Friday. She was not that concerned about the motion. In fact, she thanked the Conservative health critic, Michelle Rempel-Garner, for making an amendment that would give the government a month instead of 2 weeks to deliver the documents requested, presumably enough time to black out sensitive information. Here's what she told me.
I welcome the gesture of good faith from the Conservative Party and my colleague MP Rempel-Garner on amending their motion. I think it's much more reasonable in the way that it's written now, and I know that our parties are negotiating on the motion as we speak.
So it was a gesture of good faith. It was much more reasonable. And then I guess on Monday, here's what Minister Anita Anand had to say about the very same thing.
If this motion passes, it is my grave concern that those contracts are at risk. Those negotiations are at risk. And suppliers will then, as a result, be hesitant to contract with the federal government. And that chill on our supplier relationships then undermines and perhaps negates our ability to procure additional PPE, additional vaccines, and additional rapid test kits.
Okay, so what changed? Let's dig into this. The Liberal House Leader Kevin Lamoureux joins us. So does the Conservative health critic Michelle Rempel-Garner and the Deputy NDP health critic Jenny Kwan. Great to see all of you. Mr. Lamoureux, let me just start with you. I told you, you just saw it. Patty Hajdu said this was reasonable. She actually thought it was a gesture of good faith by Michelle Rempel-Garner, who's on. Now Minister Anand saying this is going to jeopardize Canadians' health. Why does your health minister have a different view than your procurement minister?
I think that, Evan, we can start off by saying everyone will agree that we're well into a second wave of the pandemic, and there is a need for us to be working together. I believe at the end of the day that the passing of the motion is not something that's good for Canadians' health and well-being going forward. There's other things that we could be doing at the committee stage, and there's an overreaching of all sorts of information. We're talking about literally hours and thousands of documents, and the potential is virtually endless. It's not just the politicians that are saying this. We have
okay, but Mr. Lamoureux, listen, I get that, but yes, your health minister, the second wave, we were well into the second wave on Friday, sir.
Yes.
I don't understand why your health minister thought it was reasonable on Friday. Now it's jeopardizing Canadians' health on Monday. Why can't civil servants just simply work with the law clerk and black out sensitive information? It's not their first rodeo. They've been handling committees overseeing sensitive information for generations. What's the issue here?
That's right. But this is the first time in which we're dealing with the pandemic, and the amount of hours that are being requested when you have a civil service, which I must say is just doing an outstanding job in terms of providing the type of advice, working with the different levels of governments, the different stakeholders. Our civil servants are very busy. And the overreach that's within this motion is, in fact, I believe, not in the best interests of Canadians' health and well-being. There's all sorts of things in which the Health Committee can be dealing with. They can leave it with the committee to have those discussions and to provide the information, call the witnesses that they feel is necessary. But this is by far overreach, and it is putting into jeopardy, I believe, a number of things related to our supply chain. We need to be aware of that.
Okay, well, Michelle Rempel-Garner, I guess the health minister missed that memo on Friday, but what do you make of the fact it's passed now? But there is a legitimate concern from Pfizer, from some doctors, that this is basically a kitchen sink that you're asking for, quote, all documents, including but not limited to, and then you list everything from rapid testing to health guidelines, all, quote, memorandum, all emails, all documents, all notes, and all other records. Is it too much?
Parliament's doing its job. Imagine that. Look, I think that the health and safety of Canadians is at risk right now. We're seeing record cases of coronavirus. We don't know when rapid tests are coming into Canada, when they'll be widely available. We don't know why there's been a delay. We don't know where Canada is at in terms of procurement for vaccines, like where we are on the list for delivery. So those are issues that the government has not been transparent about. And that's why we want this information, because if we're really delayed, if we're looking at, months and months before those situations are rectified, then Parliament has an obligation to fix that so that Canadians can be healthy and safe. Now, I think the reason why you saw the difference between the health minister's message on Friday and the procurement ministers today, Evan, was because I think the government is positioning A, either for an election, or B, to not give us the documents. There are safeguards written into the motion itself to ensure that sensitive information is not unnecessarily divulged. The law clerk is skilled at doing this. That's why the law clerk has this role. And the other thing that we can do is committee has the ability to call the law clerk to say, hey, how are you looking at these documents? And then
no, I understand that, but I think that Michelle Rumpel-Garner, to be fair, though, they're concerned about the expansive nature. When you're asking for all memorandum, all emails, all documents, all notes, all other records, and not limited to, and then you've got guys like Dr. David Naylor, who, remember, your former government, the Conservative government, appointed as the chair of the Advisory Panel on Healthcare and Innovation, who's working on the COVID response. This guy's
I think he's
in the
also
Medical
a
Hall of
top
Fame.
Liberal donor,
Just a second.
too.
Yeah, okay, but hold on. Rona Ambrose, the Conservative health minister, appointed him, so he was good enough for the Conservatives. Yeah. And he said, you're dredging the harbor. The timing of this specific mood baffles me, he writes. It's a bit like asking a driver of a crowded bus to focus on the rearview mirror while the vehicle is zooming forward on a slippery road in steadily worsening hailstorm. Why wouldn't you listen to Dr. David Naylor on this?
Look, we're listening to the will of Parliament and to Canadians. We need to know why we don't have rapid tests when we're getting rapid tests, so that we can get back to some sense of normalcy in this country, so that businesses don't have to keep closing because we have no other plan other than economic shutdown. And we need to know where we're at with vaccine procurement. I don't accept the government saying that we can't look at this. The government prorogued Parliament. It shuttered Parliament. The Liberals have blocked these motions at committee. We haven't had a budget in 2 years. It's about time that Parliament functioned. And this information is necessary. This is, we've seen this government try to hide information and do everything that it can to not review this. This is about moving forward and coming up with the best plan for Canadians to deal with coronavirus and the response that the government has had. So I'm very excited today. This is a wonderful step for Canadians that ultimately will keep them healthier and safe. And I don't accept the argument of a Liberal donor.
Well, I wouldn't besmirch Dr. David Naylor. He certainly worked for the Conservatives. I'm surprised you're attacking his reputation. But let me just go to Jenny Kwan. Jenny Kwan, look, drug companies are clearly worried. Let me bring in another doctor, epidemiologist, and Dr. David Fissman called this an audit from hell, writing, you're going to tie up the procurement, Health Canada, not to mention companies the government is working with to procure vaccines and tests with what looks like an audit from hell. Every government bureaucrat department isn't already hanging on by their fingernails trying to build system structures and responses to protect the Canadians. And there's NDAs with vaccines. So, Jenny Kwan, I ask you, are you trying, instead of using a scalpel to investigate, are you using a hatchet when basically government's trying to deal with a horrific second wave?
Well, the New Democrats supported this motion. Why? Because COVID-19 is the single biggest challenge that Canadians face, and in fact, I would argue that the world faces. We went through the first phase and we ran into a whole range of problems. Healthcare workers weren't able to get their personal protective equipment, for example. Even just weeks ago, we had a report from the nurses union raising these issues as an ongoing concern. We're now heading into the second wave. In fact, we have begun the second wave. So I think it is very important for us to get some information to Canadians and have some transparency with Canadians. so that we can learn about where the system failures were with the first wave and to do a better job to ensure that the health is protected for Canadians. So
are you not, I concerned, but are you not concerned that maybe it's too expansive? And let's just focus on that the wording allows the opposition to basically ask for everything. Was there no way for all of you folks to find a compromise here, Jenny Kwan, to make it a little less expansive, because you are in the middle of the second wave?
Well, I think that the motion was amended in terms of giving it a lengthier timeline, and then there are provisions within it to say that even within that expanded timeline, if there are difficulties, that they could go back to the committee to try to work these things out, so that I think that could be worked out within the committee. The reality remains this: we have seen the Liberals filibustering the Finance and the Ethics Committee, saying that they can't look into the COVID issues, they can't look into a whole bunch of other things, and to saying that because they are focused on COVID. So here we are, this is the Health Committee. This is the job of the Health Committee to look at this single most important issue that's faced by Canadians right now. But even then, it's not good enough. And it doesn't make any sense. You yourself have said so, Evan, that the Minister of Health on Friday said, oh, no, that's great. We actually have some goodwill here. We can actually get this done. And then on Monday, you have the procurement minister saying something else altogether. The minister, the government needs to get it together, and the government needs to stop hiding. They need to be transparent and be forthright with Canadians, because you need to ensure that to maintain public trust.
Listen, Mr. Kevin Lambert, there's a good point here. The pandemic is not a substitute for the mechanisms of democracy. And it's a bit ironic that the opposition, which criticized your government for too many redactions on the we controversy, in other words, for overly blacking out information, now your government's complaining that you can't black out enough information. Look, you got a month to do it. Why is this so difficult to basically walk and chew gum at the same time?
You know, Evan, if you were to actually read through the amendment on air, it would take you a long time to go through it. When the types of things that you made reference to, you know, whether it's the masks or anything else that's being required, the vaccines, all of which Canadians are genuinely concerned about. That supply chain is absolutely critical, and we don't want to do anything to compromise it. But if you take a look at all the demands within that resolution that was actually, or that motion that was passed, and then look at the number of departments that it also has to apply to, it is very wide in its scope. It's demanding. It's literally going to take many hours of civil servants that are in fact trying their very best already to provide the service that's necessary in order to fight this.
Yeah, that's their job.
So what? It's important.
Like
this is something in which all members of the parties, all parties, provinces and everyone agrees that the pandemic is the #1 concern of Canadians, as it should be. The health and well-being of Canadians matters. And this resolution that
let me just, because I'm running out of time. Michelle Rumpel, I'll give you the word here. Michelle Rumpel, just quickly respond, and then I got to go to a break.
I think it's a little rich for the government to be saying that people whose actual job it is to produce these documents, who we know have not been prioritized. There was a big story about freedom of information requests last week, can't do this job. I think it actually is kind of insulting to our public service. This is the type of information that Parliament needs to move forward. I think, as my colleague Ms. Kwan said, this is information that we can use to find a best path forward for Canadians' health. Everything's fine in here. And if there's nothing to hide, the government has nothing to be concerned about. So I look forward to working with my opposition colleagues on a respectful study to find better answers for Canadians. And I hope that the result of this motion, and I know it will be, is that Canada's going to have a better path forward on the pandemic.
Evan, we
guys,
want
unfortunately,
to
got to
work
leave here. By the way,
thank you so much.
well, we have to now. The motion's passed, so I hope that you do.